Hi, and welcome back to In the Hot Seat with Emily Diala and Dr. Viviana Coles. I'm Emily, and this is Dr. Coles.
Hi.
So we are on the second episode of our series on sex addiction or compulsivity or problematic sexual behavior. And we kind of laugh about that because people put all different labels on what constitutes problematic behavior. And we're going to go into that a little bit more today.
I think we find that I know in my office, I see a lot of couples who come in where one person has been labeled a sex addict or a porn addict by their partners, and it doesn't fit for them.
Right.
And that becomes a problem in and of itself.
Yeah. So let's just clarify a few points. First of all, sex addiction does not function in the brain the same way that a drug, alcohol, or opioid addiction does. So there's a lot of differences between, a drug and alcohol addiction and a sex addiction. Furthermore, the American Psychological Association has been unable to classify sex addiction as a diagnosable disorder in the DSM, which is the Diagnostic and Statistical Manual for Mental Disorders. So it's not even a true label of a diagnosis the way, an anxiety disorder is.
And you would think it would be, considering it's used so much in media.
Yeah.
It's been published widely and used as even themes for shows on TV.
Right.
And I think that the good thing about, at least what I think has come about it, is that it gets people talking.
Right.
It's brought
light.
these issues to light. And it's also created treatment strategies. Now, that becomes problematic as well, because what chicken or the egg?
Yes.
Are you going to have the treatment and then people want to find something to use and then the label comes?
Exactly.
Or do you want to say, okay, this is the problem, let's form a treatment after it? And so we as even, as clinicians, we aren't on the same page as a lot of people in our field. And it is a struggle that I think most mental health professionals still haven't really nailed down for themselves.
So I'd like to share a little bit of my personal experience with this. So I was, on the track to become a certified sex therapist, which I am. And meanwhile, it was advised to me that I also become a certified sex addiction therapist because it was, happening all over the place. So I went through that training as well and became certified. But literally, it was before I even went to the first training module that I realized I had a lot of problems with the model. So as part of the training, you're required to take the sexual addiction screening assessment. So what I noticed right away was that a lot of behaviors that and I think most sex therapists consider perfectly healthy were pathologized on this sex addiction tool.
Like what?
Like, do you use sex toys during, your partnered sexual activity? Or do you enjoy anal play? Or how often do you masturbate? And I just, I'm filling this out and thinking, there's no way that
it's almost like, is there a wrong answer, a right answer?
Exactly. I'm like, probably 75% of the people who complete this assessment tool would be labeled a sex addict. And I had a big problem with that. But I wanted to keep an open mind, and I went through and, as I said, completed the training. But it just wasn't long after that I realized there were too many problems in the treatment that I personally disagreed with. I really think of all the sex addicts that I've treated, there have maybe been one or two who I think were, far enough along where they were repeating this negative behavior repeating this behavior despite repeated negative consequences and just going back. Whereas a lot of people were just having trouble managing a specific sexual desire they had, or there was a discrepancy in the desire in the relationship and they were having trouble negotiating that in a way that fit for both people.
Or they're trying to figure out why this person may not be cut out for monogamy and saying, oh, well, you're a sex addict.
Right.
These are all things that the nuances of being a sex therapist that we are able to kind of take a look at it and tease it apart and not just put everything into one bucket.
Exactly.
And not to say that every CSAT is going to do that.
No.
But inherently, the word addict really does trigger a lot for some people. Some people will like the label and choose to use it in a way that helps further their attempts to try to overcome the problematic sexual behavior.
And to help them understand it. I think
help
for
them
some
to
people
understand
it gives
it,
them a
get
framework.
resources, maybe talk to other people, maybe join groups.
Right.
But for most people that I've seen, it's something that burdens them and helps them to feel less than.
I think it's very shame-based. I think that there are a lot of components of the model that, exacerbate the feeling of shame that they had. Now, having a couple of affairs throughout your marriage, there's a degree of shame you may feel about that when you get caught. But to, bring it around and pathologize it, and now you have to do all these 12-step groups, and you have to,
it just more public.
Right, exactly. I really think that for many of the clients I was working with, it exacerbated the shame. And it also took away from the treatment itself, took away from the relationship. So then you have these partners who are hoping to reconnect, and they never get time with their partners because they're at meetings all the time.
Exactly, they're having this whole separate,
right?
Very and oftentimes very private, like you were saying, in secret. And these are things that's not what we're trying to promote here. And then it just obviously isolates them, and sometimes relationships can fail because of the treatment and the way that people go through this.
So ASECT, which is the American Association of Sexuality Educators, Counselors, and Therapists, which is what I hold my certification through, recently came out with a position statement basically saying that they don't believe, in sex addiction as a diagnosis, and don't agree with many of the treatment models that are out there for it. So
be conscious of
educate yourself.
Educate yourself. Look at some resources. You're welcome to email us. You can make some comments online, and we can give you some resources to help you to figure out if problematic sexual behavior treatment is something that you should be seeking, either as a couple or as an individual. And we'd love to hear your comments online at #HotSeat, and hopefully we'll see you again in another episode.
Bye-bye.